What if the sign your body gave you wasn't a scream, but a whisper? Every day, women across America feel tired, dizzy, maybe a little off. They chalk it up to age, stress, or just one of those days. But what if that moment, just a few seconds, was your only warning before a stroke? A woman in our community shared this. I was only 39. I felt pain in my calf, nothing else. Later, I found out it was a clot passing through a hole in my heart. I had no idea until I collapsed. That's why this video matters. Not to scare you, but to wake you up to what could save your life, or the life of someone you love. Because when it comes to strokes, silence is deadly, and awareness is everything. Every 40 seconds, someone in the United States has a stroke. That's a staggering number. But here's something even more alarming. One group is quietly at greater risk. And it's not who you might expect. It's women. Now, you might be thinking, isn't stroke mostly a concern for older men? That's the myth. The truth? Women not only experience more strokes than men, they're also more likely to die from them. Worse, many women miss the signs until it's too late. Why? Because their symptoms often don't look like the classic warning signs you see in posters or commercials. They're quieter, subtler, easier to dismiss. Christina, a viewer just like you, shared this in the comments. My first stroke came with a headache. That's it. The next morning, I collapsed. I couldn't move. I was only 34. That's why this conversation is urgent. Because when you recognize the signs early, you can act fast. And acting fast means protecting your brain, your independence, and your life. So today, we're going beyond the basics. We're diving into 10 warning signs of stroke in women. What they look like, how they feel, and what you can do the moment they happen. Because knowing the signs isn't just helpful, it's life-saving. And if you stick with me until the end, I'll also share 2 powerful free gifts designed to help you protect your heart and brain for the long haul. Let's begin. Why is it that so many women don't recognize a stroke, even as it's happening to them? One big reason is this. The symptoms don't always look like what we've been told. You've probably seen posters with slurred speech, a drooping face, or one weak arm. And yes, those are classic signs. But here's what most people, and even some doctors, don't talk about. Women often experience different symptoms, ones that don't scream stroke. Instead, they whisper. We're talking about sudden fatigue, nausea, confusion, fainting, maybe even just feeling off for no clear reason. According to the Mayo Clinic and the CDC, women are more likely than men to show these non-traditional symptoms. And when those signs show up, they're often mistaken for stress, anxiety, or even menopause. Think about it. If you felt a bit dizzy, would you rush to the ER? Probably not. You'd assume it's dehydration or a bad night's sleep. But that delay, those crucial minutes, could be the difference between a full recovery and long-term damage. And here's something else. A woman is more likely to live alone at the time of her stroke, which means no one else is there to spot the signs. No one to say, "You're not making sense. Let's get help." That's why it's not just important to know the signs. It's critical to know how they might look different for you. Because instead of thinking, "This doesn't feel like a stroke," what if you asked, "Could this be something more?" When you ask that question, you open the door to action. And action, as you'll see, saves lives. Before a stroke strikes like lightning, it often shows up like a passing cloud. These signs, subtle, strange and easy to overlook, can appear days, even weeks, before the actual event. And if you've ever told yourself, "I just feel off lately," this next part is for you. Let's look at 5 early warning signs that women often ignore, but shouldn't. 1. Unexplained fatigue that doesn't go away. We all get tired, but this isn't the "I stayed up too late" kind of tired. This is the kind that hits like a wall. One day you wake up and feel drained before your feet even hit the floor. No matter how much you rest, the exhaustion lingers. It's your brain telling you something's wrong with how it's getting blood and oxygen. 2. Sudden mood swings or confusion. Have you found yourself snapping at someone for no reason? Or forgetting things that were second nature just a week ago? These aren't just emotional blips. They may point to changes in brain function tied to restricted blood flow. 3. Sharp, unusual headaches, especially if you're not someone who typically gets headaches. A thunderclap headache, one that comes on instantly and feels explosive, can be a sign of a bleeding stroke, but even dull, persistent pain could be worth checking out. 4. Dizziness or feeling lightheaded for no clear reason. You're walking through your kitchen, and suddenly the floor feels like it shifted. You have to reach for a counter or sit down. Sound familiar? That might not be just dehydration. It could be a sign your brain isn't getting the support it needs. 5. Changes in vision, blurring, flashing lights, or double images. Some women report what looks like a curtain falling over one eye. Others see flashing lights or blurry shapes. These aren't just eye problems. They can be the brain's first cry for help. Here's the bottom line. Instead of brushing these signs off as just aging or a bad day, consider what your body might be trying to tell you. Because the earlier you catch a stroke, the more of your life you protect. And now, let's look at the most critical signs, the ones that demand immediate action. Now that we've covered the early whispers, let's talk about the louder signals, the urgent red flags that say, "Act now." These are the 10 most critical warning signs of stroke in women. Some will surprise you. Others may feel familiar in a new, more serious light. So, let's count them down. Number 10. Sudden numbness or weakness in the face, arm, or leg, especially on one side. You wake up and feel like your hand won't grip the coffee cup, or one leg feels heavier than the other. Maybe your smile looks a little off in the mirror. This isn't just fatigue. It's a sign that the part of your brain controlling movement may be starved of oxygen. To check quickly, try lifting both arms. Does one drift down? Or ask someone to smile. If one side doesn't rise, call for help. Fast. Number 9. Mental confusion or trouble speaking. You're trying to say something simple. The sky is blue. But the words get tangled. Or worse, your brain knows what you want to say, but your mouth won't cooperate. This disconnect is more than frustration. It's a sign the language centers in your brain, like Broca's or Wernicke's area, may be under attack. If someone suddenly seems confused or can't follow a basic sentence, don't wait it out. Time matters. Number 8. Vision problems in one or both eyes. Imagine suddenly losing half your vision, or seeing double, or watching everything blur like looking through frosted glass. These changes could mean blood flow to the occipital lobe. The brain's vision center is being blocked. Cover one eye, then the other. Any gaps in sight? That's not normal. That's urgent. Number 7. Dizziness or loss of balance. We all feel a little unsteady now and then. But this is different. You stand up and the room spins. You try to walk, and your legs won't cooperate. Strokes in the cerebellum or brainstem, the parts that control balance and coordination, can show up as sudden instability. If you can't stand on one foot or walk in a straight line without wobbling, don't assume it's just a bad day. Call for help. Number 6. A severe headache with no known cause. It hits like a hammer. No warning, no buildup. Just instant, intense pain. This kind of headache, often called a thunderclap headache, can be a sign of a hemorrhagic stroke, where a blood vessel bursts in the brain. It's not like a migraine or tension headache. It's sharper, faster, and it doesn't wait. If it comes out of nowhere, especially with nausea or confusion, go to the ER. Now. Number 5. Sudden trouble walking. You're fine one moment, then suddenly, your legs don't feel like yours. You stumble. You reach for furniture. This could be your brain's motor system misfiring, and it's not something to brush off. If walking becomes difficult without any clear reason, treat it like an emergency. Number 4. Unexplained fatigue. This isn't just a rough morning. It's overwhelming, like your whole body has lost power. You might feel like lying down in the middle of the day, no matter what's going on around you. Why? Because your brain might not be receiving enough blood to keep your body energized. Fatigue is often dismissed, especially in women. But in the context of other symptoms, or if it's unusually intense, it's a red flag. Number 3. Face drooping or an uneven smile. You've probably heard of this one. But here's the twist. Sometimes it's subtle. One side of your mouth may barely sag, or your eye looks slightly different. Try the smile test. If one side doesn't rise as high, don't ignore it. Even minor facial asymmetry can be a major warning. Number 2. Sudden nausea or vomiting without a clear cause. You're not sick. You didn't eat anything bad. But suddenly, your stomach turns and you feel like throwing up. This can happen when a stroke affects the brain's vomiting center, especially in the brainstem. Because it seems like a stomach issue, many people overlook it. But when paired with dizziness or vision issues, it's a strong signal something deeper is wrong. Number 1. Brief loss of consciousness. This is perhaps the most terrifying. One moment you're upright. The next, you black out, gone for a few seconds. Some call it fainting. But if it's sudden, with no explanation, it could mean a serious drop in blood flow to critical areas of the brain. Don't chalk it up to stress or blood sugar. If you or someone you love passes out without warning, treat it like a medical emergency. Here's what all these signs have in common. They can be easy to misread, easy to brush aside. But strokes don't wait, and neither should you. So instead of saying, "Let's see how I feel in an hour," say, "Let's go now." Because when it comes to your brain, time is not just money. Time is life. Now here's where things get tricky. Some of the symptoms we've just talked about, like fatigue, dizziness, nausea, even confusion, can also show up during moments of stress, or anxiety, or a migraine. So how do you know the difference? That's the challenge many women face. You feel off, but you chalk it up to being overwhelmed. You tell yourself, "I've just been under pressure lately." Or maybe you assume it's hormones, or age, or something you ate. But studies show something critical. Women under 50 who experience high levels of stress have up to a 78% higher risk of stroke. And migraines? They're more than just a painful inconvenience. In women under 45, migraine has been linked to as many as 1 in 3 strokes. So, no, it's not just a headache. And no, you're not overreacting. The problem is, we've been conditioned to push through pain, to downplay discomfort, to wait until something becomes obvious. But with stroke, waiting can be devastating. Instead of saying, maybe it's nothing, ask yourself, what if it's something? Instead of brushing it off, check in with your body. Because even if the symptoms overlap, your response doesn't have to be passive. You can choose to take them seriously. You can choose to act, while there's still time to make a difference. So what should you do if you suspect a stroke? Whether it's you or someone you love. Timing is everything. Every second your brain goes without oxygen, more damage is done. That's why doctors created a simple way to remember what to do. It's called BEFAST. B. Balance. Are they suddenly dizzy or unsteady? E. Eyes. Is their vision blurred or lost in one or both eyes? F. Face. Ask them to smile. Does one side droop? A. Arms. Can they raise both arms evenly? S. Speech. Ask them to repeat a simple sentence. Do they slur or struggle to find words? T. Time. If you see any of these signs, time to call 911 immediately. Don't wait. Don't drive yourself or let them lie down to see if it passes. Because in stroke treatment, there's a golden window, about 3 to 4.5 hours, where doctors can administer clot-busting medication. But that only works if you get there in time. So instead of hesitating, hoping it's nothing, move, act, make the call. You might just save a life. If you're wondering, what can I do today to lower my risk? You're already ahead of the curve. Prevention doesn't have to be overwhelming. It starts with knowing your numbers, especially your blood pressure and cholesterol. High blood pressure is the leading cause of stroke. But it's also one of the easiest to manage when caught early. Get your heart checked. Ask your doctor about tests for hidden risks, like high LPA, or inflammation markers like CRP. Simple blood work could help prevent a lifetime of recovery. Then, look at your daily habits. Instead of a salty snack, choose something with potassium, like bananas or spinach. Instead of long hours sitting, take short walks. You don't have to become a marathon runner. Just move more than you did yesterday. And finally, find small ways to lower stress. Whether it's prayer, meditation, or just laughing with a friend. Your mind and your heart are connected. Stroke doesn't have to be your story. But if you want to write a different ending, the time to start is now. You've just taken a powerful step, one that could change or even save a life. And to thank you for staying until the end, we have 2 free gifts just for you. First, an exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. Second, a video that reveals a shocking cause of cardiovascular disease and what you can start doing today to fight it. You'll find both links in the description below. But more importantly, don't keep this knowledge to yourself. Share this video with someone you love, a sister, a friend, a neighbor. It could be the one thing that saves their life. And if this message touched you, don't forget to subscribe. We're here to help you protect your heart, your brain, and your future. Stay safe, stay informed, and stay strong.